Assalamu alaikum and welcome back. Our today's video is about diabetes. Diabetes is a chronic disease and it occurs when body is not able to utilize the insulin or pancreas is not able to make the insulin. Now it may come in your mind, what is insulin? Insulin is a hormone that is produced by the pancreas and it works as a key to take the glucose from the food and take it into the cells and use as a energy. Now this glucose from where it's come? Whenever we are eating a food that has carbohydrate, during the breakdown of these carbohydrates, the glucose release in our body. So the insulin function is to utilize this glucose. When the insulin is not releasing enough or it's not utilizing by the body, the glucose level in our body increase and it damage our body or it let number of organs to go for failure. Now we will talk about the types: type 1, type 2 and gestational. The type 1 is more common in the children and adolescent. This is about 10% of total diabetes patient. In this type, what is mainly happening? The pancreas is not able to make the insulin, or it is making a very small amount of insulin. So to maintain the glucose level, the patient need to get the injection of insulin. The type 2 is more common type of diabetes. The most of the patient, like 90% patient, are having a type 2 diabetes. This can be controlled by medication, healthy lifestyle, exercises and some other supportive treatment. What is difference between type 1 and type 2? In type 1, pancreas is not able to make the insulin, or it is making a very less quantity of insulin. In type 2, the body is not able to utilize the insulin. Now we will talk about third category, which is gestational diabetes. This is happening during the pregnancy and it causes complication for the mother and for the baby. Most of the time it get better or it resolve or it's okay after the delivery, but it has a risk for the baby to develop type 2 diabetes in later age. Now we will discuss about sign and symptom of type 1 diabetes. The first of all, the more common is frequent urination, dry mouth, feeling thirsty, tired, loss of weight, lack of energy, constant hunger, blurred vision and bedwetting. How we can manage type 1 diabetes? As I told in the start, this need insulin. So there are 4 types of insulin which we are using to control type 1 diabetes. The first of all is rapid acting insulin. This patient is injecting with the meal or just before meal because it starts its effect very quickly, immediately after injection. The patient should avoid the overdose because if the patient will take overdose of this insulin, it will take the patient immediately into the hypoglycemia. The glucose level suddenly will drop down, which will cause more complications. The rapid acting insulins are aspart, glulicin and lispro. The next one is short acting insulin. This insulin patient is taking before food. The second name of this insulin is regular or natural insulin. Because they do not act like very quickly, that's why these insulin are more appropriate in a certain people. Short-acting insulins are Actrapid, Humulin R and Insuman Rapid. Now we will move to the third category of insulin, which is intermediate acting insulin. These insulins has been taken by the patient with the short-acting insulin. Intermediate acting insulin start to work within the first hour of injection, followed by the period of peak hours, and it lost within 7 hours. Intermediate acting insulins are Humulin, NPH, Protofen and insulated. The fourth category of insulin is long acting insulin. These insulin release in the body slowly and it stay up to 24 hours. Commonly, these insulin has been taken at the time of evening or twice in a day, like morning and evening. Long acting insulins are Detamir and Glargine. There are two common insulin taking plans, like twice daily insulin and basal bolus regimen. In twice daily insulin, patient is using short acting insulin and intermediate acting insulin. In basal bolus regimen, the patient is using only short acting insulin and he or she is taking 3 times in a day just before food. Hope you like my video and it was really clear. If it is clear for you and you understand the concept of type 1 diabetes and the difference between type 1, type 2 and gestational diabetes and the function of insulin, then share this video with your family and friend. Press the like button and subscribe this channel for further informative video. Inshallah, in next topic, in next coming video, we will discuss about self-monitoring, healthy nutrition, physical activities and prevention of type 1 diabetes. And after the coming video, in next topic, we will discuss about type 2 diabetes. Thank you so much for continued support.